Doc, I got to ask this question because, of course, more messaging today that a lot of folks, doctors included, said they were confusing about Johnson & Johnson and AstraZeneca. Can you just tell our audience why, why NACI is saying if you want to wait for an mRNA vaccine, in other words, AstraZeneca or Pfizer, yeah, you should, but there are young people in their 30s and 40s in ICUs right now, as you know, across this country. Why shouldn't NACI just say, we understand there are risks, the best vaccine is the first one to take? Why give people the option to wait when the variants are ravaging even young people?
Because it basically depends on where you are. So if you are in an area where there's no COVID, then waiting for your mRNA is okay. What we're saying is really, do an individual risk assessment. If you're in an area where there's tons of COVID, the transmission is high, then I absolutely agree. The first vaccine that comes is the one that you take. However, given the number of doses of mRNA vaccines that are coming within the next week or so, if you have to know that the AstraZeneca and the Janssen vaccine come with risks of VIT, so of this thrombosis that might happen. And so, as I say, if you don't have any risk of catching COVID, either because there's nothing around you, because you're working from home and you're not seeing anyone, are you going to take the risk of 1 in 100,000 of having a thrombosis? Or are you going to wait 2 to 3 weeks and then get the mRNA vaccine for which there's no safety signal of that sort? So it's really this transparent message that we have tried to send to Canadians in general.
But I just wonder, because if you look, Ontario's in a lockdown, Quebec's fighting it, BC's and Alberta. Now we're seeing everyday stories of people in their 30s and 40s who are in ICUs. Doctors are completely overwhelmed, as you know. Like, why give people this kind of option? They're not epidemiologists, they're not doctors. Why not just have a consistent message that's aligned with Health Canada and said, look, you all know the risks of AstraZeneca or Johnson & Johnson, but look, AstraZeneca has been taken over 100 million times. All of the UK has taken it. There are some risks, but the risks of COVID are so overwhelming. Take it, take it, take it. If you want, you give the option. Isn't that just contributing to confusion and hesitancy?
Well, I don't think so, because, see, the problem is if you say that any vaccine is equivalent to another, which could be true in some circumstances, you also require people to be able to make that decision. And what we want is to protect people who are not able to think necessarily through the pros and cons of every vaccine. The question is really to say, this needs to be an informed consent. If, for instance, my sister was to get the AstraZeneca vaccine and die of a thrombosis, when I know that it could have been prevented and that she's not in a high-risk area, I'm not sure I could live with it. So it's really through that
but that's so rare. Like, I understand that, but
I agree with you.
It's so rare, but when you say that, risk is not necessarily calculated, rationally. People are more scared of the vaccine, but they're going to drive in their car. There might be 20 car accidents in their city if they don't stop driving.
I agree.
So I'm just, when someone of your stature says that, gosh, what if it happened? But it's so rare. It's significantly more dangerous to get COVID.
It is when there is COVID around, and that's what we've been saying. It means, you have to look at the epidemiology in your area, and that's why provinces have to look at it personally. If you're in Toronto and the incidence rate is very high, I fully agree. Your benefits outweigh risk by magnitude. But you really have to see what your risk and what's happening around you. We can't just say that for every circumstance, all the vaccines are equivalent, because there has been this safety signal with the viral vector vaccines. Honestly, I would have loved that no safety signal ever arose, but they are there, and I can't, again, push them under the carpet.
Right. I mean, I know Health Canada says they're all safe, but then NACI's got, as you say, you're talking about the risk. NACI also today recommended mRNA vaccines for pregnant women. Are viral vectors vaccine too much of a risk? So just so people appreciate, you've recommended Pfizer and Moderna, but not necessarily Johnson & Johnson and AstraZeneca. Can you outline that?
Correct, because we have well, first, none of the pregnant women were not included in those clinical trials for any vaccine. However, we have now 34,000 women or so that have been vaccinated with an mRNA vaccine in the US who were pregnant and that were followed during pregnancy, in whom no adverse event occurred. So at least we have data for the mRNA vaccines in pregnant women, which we don't have for the viral vector vaccines. On the other hand, if a pregnant woman was to develop a thrombosis associated with a viral vector vaccine during pregnancy, that would be impossible to treat. And so that's why we favored the mRNA vaccines for pregnant women.
A lot of people are wondering, okay, I know a lot of provinces are saying everyone 18 and up in May. A lot of folks are saying, what about my 17-year-old, my 16-year-old, my 10-year-old? When will under 18s be safe to get vaccinated?
So that's coming. We're waiting to hear from Health Canada for their authorization for the 12 to 15-year-old. At this point in time, Pfizer is already approved for 16 and over. So in some provinces for teenagers with medical conditions, they have been vaccinated if they're 16 and older. For the 12 to 15, we expect to have vaccination programs in place during the summer, early fall. At this point in time, 6 months to 12 years of age are currently being enrolled in studies to make sure that we understand what dose to use, that they are immunogenic, safe, and efficacious. So that should come, I guess, towards the end of 2021.
Just finally, because of the hesitancy and all these risks, you got this New York Times article concluding that the U.S. is not even going to be able to achieve herd immunity, not only because of the spread of the variants, but also because of vaccine hesitancy. A lot of folks, by the way, aren't even taking their second shot. What does Canada need to do to achieve herd immunity?
I'm not sure. I don't think I have the magic recipe. What we're aiming for is at least 85% of vaccination coverage. But how to get there? I mean, at this point in time, we're still in the period where vaccine supply is constrained. So people who are going for vaccines are people who want to. And I think we should move through that line of people who want to be vaccinated, give that second dose as quickly as possible, and then get to people who are hesitant. But I think that, talking and being transparent with the data so that hesitant people don't feel that we're trying to hide things from them is what is going to be most useful to my stand, right. I guess.
All right, I do have to leave it there, even though I feel like I'm now on the non-preferred vaccine list. I'm an AstraZeneca guy. But
at the same time, you're
super happy to be there. I'm happy.
Exactly.
I have no problems.
But that's an individual decision, and I think it was a great decision from where you live.
I'm feeling good about it. Dr. Caroline Quach, thank you so much for joining us.
Thank you very much.